Hello everyone, I'm Dr. Sring Yuden from Bhutan and I graduated my BPS from the University of Peradeniya, Sri Lanka. So today I'm going to talk about the circumcision, okay? Like a young couple comes to your clinic, their family have told that their firstborn male baby has to be circumcised, so they have no idea and they are not particularly obliged towards religious belief, so they are coming to you for a consultation whether they should get their baby circumcised or not. So what should you do? So basically, circumcision is removal of the foreskin of the penis, and it is not a routine procedure that is done. However, if the family requests based on their religious belief, then we do offer, and also like after proper explanation of the advantages, disadvantages, the complications, the contraindications, it is up to the family to decide whether they want to have their baby circumcised or not. So to tell more about the advantages of circumcision, circumcision can reduce the incidence of UTI, urinary tract infection. However, it is not indicated to prevent UTI. Like we normally don't do circumcision to prevent UTI. It is an added benefit, okay, like if you do circumcision. And also, although controversial, circumcision is found to prevent the incidences of sexually transmitted infections like HIV and syphilis, hepatitis, etc. And also, circumcision can reduce the incidence of penile cancer. It mainly relates to the ability to maintain hygiene. Like if you remove the foreskin, then you can maintain proper hygiene of the penis. So that's the rationale behind to reduce incidence of penile cancer. And in medical terms, in surgical terms, circumcision is indicated in condition called phimosis, where the foreskin adheres tightly to the glands and it fails to retract. Saying that, usually for children until they are of 5 years or more, their foreskin is almost always covering the glands, so it does not mean they are having phimosis, okay? So circumcision can be done if there's a phimosis or to prevent phimosis. And yeah, so those are the advantages of circumcision. The disadvantages of circumcision are like any other surgery, there is a risk of hemorrhage, which is excessive bleeding. There is a risk of ulceration of the glands. There is a risk of inadvertent damage to the urethra. There is a risk of infection following the surgery. And then if the skin is removed excessively, it might lead to unsatisfactory cosmetic appearance, and then anesthesia related complications. So these are the complications, and sometimes because of a surgery it might lead to secondary phimosis. So yeah, these are the complications of circumcision. Usually the commonest complication is hemorrhage, and they say it's 1 to 5% risk of complications, but it depends on the expertise and the availability of facilities, expertise of the surgeon performing circumcision. And there are certain conditions where circumcision is contraindicated, no matter the religious belief or no matter the personal choice. In circumstances such as epispadiasis or hypospadias, a condition where the urethra is a medical term for anatomical term for a urine channel. If the opening is not in a correct position, if the opening is under the penis or on top of the penis, then we say hypospadias, epispadias. In such conditions, circumcision are not recommended. Also, if the baby has a chordee is a condition where the penis is not straight and it forms a curvature due to underlying fibrous tissue formation. So, and if there's a buried penis, or if the baby has a bleeding disorder, and if the baby is really sick, like severely jaundiced, In such conditions, circumcision is contraindicated, and usually circumcision is done under local anesthesia if the baby is less than 6 months, and if more than 6 months it should be done under general anesthesia. So now you know about the advantages, disadvantages, how it is done. So it's up to your decision whether you want to have it circumcised or not. Thank you. Do you have any other questions?